to remind us of the rules of the session. And to give us our first session. As we wait for the quiz master, let the DJ give us something to set your minds at ease so that you can answer the questions.
She's
Sorry, DJ. Song supposed to say handsome. Yeah, not beautiful. Handsome. Sorry. These are reminders from the rules of yesterday. Good morning to you all. Ladies and gentlemen, thank you for being smart. The faces are looking shiny, which means things are going to be positive. Eh? Now let's remember, this is not life and death. You're here to relax, you're here to network. Extended networks from Kabali up to Muni. All those, we welcome them. So as we start this engagement, we want to be aware of a few rules. You're going to be given 1 minute for each question. And so that minute allows you to discuss. And then one of you will say the answer. So it's better that by the time you're speaking, you're sure of your answer. It makes it easy for the judges to know that you've chosen option A, B, or C. And as from yesterday, they insisted, say the letter corresponding to the answer you want, and then read a portion of the answer so that it's clear what you're referring to. We also want to be reminded that let's allow them to think. When a question is read and you're murmuring behind, you confuse their thought process. And as you saw from yesterday, some of you actually helped the people up there to get correct answers. And then you complain that it should be cancelled. Yet the correct option came from you. So allow them to think, be quiet, and if you have to appreciate, let them say the answer. Let the quiz master acknowledge the answer, and if it is correct, you can clap. We will relate later, but for now, let's clap in appreciation of their response. And if we have a query, if we have a concern, we feel we have not been treated the way we deserve, or our response is correct, but the quiz master is saying it's wrong, then one of you, that's why you're 10, one of you will quietly approach the desk of the adjudicators, and you'll make your concern felt there. Then before the session ends, the judges will have time to go through your query and give you feedback. Lastly, the guys on AV, audiovisual, have requested that you position yourself in such a way that you allow this camera to capture your side. Ladies know how to present the beautiful side. So if you have ladies, when they present the beautiful side, you know that is the side you should also present to the camera, so that people online can see you. The complaints online are saying we are seeing those guys' backs, We don't know who they are. We want to be sure they're from our university because they're picking so many wrong options. You relax. We taught them correct things. They're shocking us. No. So you show them you're the ones. Eh? Tell them the pressure. The pressure was too much. We were only seeing wrong options. Okay, so those are the few reminders for us. Unless I have any I've missed from the judge's desk. The last reminder is about time. The 1 minute you're given, be reminded that you'll be told that 30 seconds to go, and that's the last reminder you'll get. Next thing you know, the bell will go to show you it's time. And if you give a response after the bell goes, then it's considered null and void. So you want to remember that. Then you are requesting the timekeeper to move away, step away from the desk so that you're sitting separate and you're able to focus on just timekeeping so that we don't get the issue of yesterday. The answer was matching. For the guys who are giving us responses, we have a clock which we place at the pulpit here. So we should also remind you to pay attention to it so that you're not caught up in the 1 minute that you're given. So I guess with those reminders, I can hand the microphone over to the Okay, so we've innovated something that will help us. The timekeeper will be flashing in your faces the seconds remaining, and it will be 30 seconds as your last reminder, and then time up. And that's it. Okay, the rules are becoming too many. So do you prefer to be reminded at 10 seconds or 30 seconds to go? By show of hands, 30 and 10. 30 in favor of 30. We're looking at desks, eh? Okay, those in favor of 10 seconds. Okay, the 30s have it. Okay, let's start. We're already behind schedule. One of you can move away so that you help us with the timekeeping. Okay, so as the technology allows us to get used to it, let's go through this custom of determining how we stand. A representative from each of the universities, please. You can come up front. Let him be the one to tell you. Number one, please.
We can correct it from here. We can All right. Welcome to day 2 of our quiz. Let's maintain order and keep our rules in mind so that we move faster. Are we ready? So let's have question 1. A patient presents with a depressed mood, anhedonia, weight loss, and early morning waking. Which of the following is the most appropriate initial nursing intervention? A. Administer antidepressant medication. B. Perform a suicide risk assessment. C. Encourage participation in group therapy. D. Refer for electroconvulsive therapy.
We are going with B, perform a suicide risk assessment.
Correct answer is B, perform a suicide risk assessment. Question 2. A patient with bipolar disorder is maintained on lithium. Which of the following can increase lithium levels? A. Dehydration. B. High sodium intake. C. Caffeine. D. Exercise.
We are going with A, dehydration.
Correct answer is A, dehydration. Question 3. A patient with bipolar disorder is in a manic phase. Which of the following is the priority nursing intervention? A. Provide a stimulating environment. B. Encourage competitive activities. C. Ensure safety and reduce stimulation. D. Allow unrestricted freedom.
We are going with C, ensure safety and reduce stimulation.
Correct answer is C. Second last question. A patient with generalized anxiety disorder presents with exercise worry, muscle tension, and difficulty sleeping. Which medication is commonly prescribed as first line? A. Diazepam. B. Fluoxetine. C. Propranolol. D. Sertraline.
We are going with B, fluoxetine. Fluoxetine.
Correct answer is D, sertraline, not B. Your last question. A patient who has been taking haloperidol for schizophrenia develops a fever, muscle rigidity, and altered mental status. What is the most likely diagnosis? A. Tardive dyskinesia. B. Neuroleptic malignant syndrome. C. Acute dystonia. D. Serotonin syndrome.
We are going with B, neuropletic malignant syndrome.
Correct answer is B, neuropletic malignant syndrome. Thank you. You can take your seat. University number 2. That is Soroti. Are you ready? Question 1. A patient with post-traumatic stress disorder reports recurrent nightmares and flashbacks of traumatic event. Which of the following is the first line treatment? A. Cognitive behavioral therapy. B. Benzodiazepines. C. Electroconvulsive therapy. D. Antipsychotics.
A for cognitive behavioral therapy.
Correct answer is A. Cognitive behavioral therapy. Question 2 for Sorority. A patient with obsessive compulsive disorder repeatedly checks the door locks 20 times before leaving the house. This behavior is known as A. Obsession, B. Compulsion, C. Phobia, D. Delusion.
B for compulsion.
Correct. Answer is B. Compulsion. A patient with major depressive disorder is started on fluoxetine. Which instruction should the nurse give regarding this medication? A. Take the medication at bedtime. B. Avoid foods containing tyramine. C. It may take 2 to 4 weeks for full effect. D. Discontinue immediately if you feel better. Yes, are we ready? Question one. Let's maintain silence. A patient with dementia wanders at night and becomes agitated. Which of the following interventions is most appropriate? A. Apply physical restraints. B. Administer a sedative. C. Provide a calm environment and redirect. D. Keep the patient in a locked room. you're choosing B, blood glucose and cardiac status. Correct answer is A, electrolytes and cardiac status. Last question. A patient with social anxiety disorder avoids public speaking and social gatherings. Which class of medication is considered first line? A, benzodiazepines, B, SSRIs, C, antipsychotics, D, tricyclic antidepressants. Five seconds. Were you choosing B for SSRI? Correct answer is B, SSRI.
Members, good morning. Just a kind request. I know you want to share them up, okay? Kindly clap when they leave the stage. Yes, let's clap because it is organized. So now they are saying, even when you are clapping, okay? Even when you are clapping, because you take long to clap, you clap and then keep quiet.
So, colleagues, it's important that when your university gives the right answer, you can cheer them up by just a small clap.
So the emphasis are on a few things. Do not talk after the clapping and don't clap for too long. So that will save time. Is that okay? Okay, let's listen to the university number 6. That is Moni. Are we ready? Question 1. A patient with schizophrenia is non-adherent to oral antipsychotics. Which of the following is an alternative? Please silence. A. Increase the dose of the oral medication. B. Add a benzodiazepine. C. Discontinue antipsychotic therapy. D. Switch to a long-acting injectable antipsychotic.
Answer D. Long-acting injectable antipsychotic.
So, can we listen from the judges at this point?
So we all realize that as they do the display, they mistakenly flipped to the neck to the answer before the question. So that question is null and void, and you're not getting that point. You're going to the next questions. Thank you.
All right. It's okay. So we are getting a different question. Then we go back and continue.
Different question, so that they have 5 sets of
So question 1. A patient with depression and a history of heart failure is being treated. Which antidepressant should be avoided due to potential cardiotoxicity? A. Fluoxetine. B. Sertraline. C. Amitriptyline. D. Escitalopram.
A. Fluoxetine.
Correct answer is C. Amitriptyline. So your response is wrong. So question 2. A patient with dementia has difficulty with memory, language, and executive function. Which of the following medications is used to slow cognitive decline? A. Haloperidol. D. Donepezil. C. Lorazepam. D. Fluoxetine.
B. Donepezil.
Correct answer is B. Donepezil. Question 3. A patient with borderline personality disorder frequently splits staff, idealizing one nurse and devaluing another. What is the most appropriate nursing intervention? A. Discuss the behavior in a team meeting and maintain consistency. B. Ignore the behavior. C. Assign one nurse to care for the patient. D. Confront the patient about the behavior.
Vital signs and withdrawal progress.
Correct answer is B, vital signs and withdrawal progression. D, remove all other patients from the area.
C. Use verbal de-escalation techniques.
Correct answer is C, use verbal de-escalation techniques. Thank you, Moni University. We can clap for them properly. It's not easy to be here. Yes. So, university number 7, must. Are we ready? Yes. Okay, let's have question 1. A patient with schizophrenia reports that the television is sending them special messages. This symptom is known as A, thought insertion, B, ideas of reference, C, grandiose delusion, D, somatic delusion.
Our answer is B, ideas of reference.
Correct answer is B, ideas of reference. Question 2. Please silence. A patient with depression is started on venlafaxine. Which of the following is the potential adverse effect? A, weight gain, B, hyponatremia, C, sexual.
Correct answer is A, naltrexone. Okay, let's have the last university, number 8. That is Bishop Stewart. Are we ready?
Yes.
Question 1. A patient with schizophrenia has been on antipsychotic medication for 2 years and now develops involuntary, repetitive, coliform movements of the tongue and face. What is this condition? A. Neuroleptic malignant syndrome. B. Tardive dyskinesia. C. Acute dystonia. D. Akathisia.
D. Akathisia.
Correct answer is B. Tardive dyskinesia. So your response is wrong. Question 2. A patient with depression and a history of seizures is being treated with an antidepressant. Which antidepressant should be used with caution? A. Fluoxetine. B. Sertraline. C. Escitalopram. D. Bupropion.
C.
Correct answer is D. Bupropion. So your response is wrong. Question 3. A patient with obsessive compulsive disorder is started on clomipramine. Which class of medication is this? A. Selective serotonin reuptake inhibitors. B. Serotonin norepinephrine reuptake inhibitor. C. Tricyclic antidepressant. D. Monoamine oxidase inhibitors.
A. Selective serotonin reuptake inhibitors.
Correct answer is C. Tricyclic antidepressant. So your response is wrong. Please silence. Second last question. A patient with somatic symptom disorder reports multiple physical complaints for which no organic cause is found. Which of the following is an appropriate nursing approach? A. Acknowledge the distress while avoiding excessive medical testing. B. Focus on the psychological aspects only. C. Tell the patient the symptoms are not real. D. Ignore the physical complaints.
The last. Here is disorganized and is unable to perform. B. C. Administer medication. Step by step. The answer is B. Last question. How are you feeling? But is it? Diagnosis criteria. A few of us can say. My neighbors. In some other room. So yes.
8 members. What? Medical surgical nursing.
Must.
Yes, sir, number.
Is it? Get 5 out of 5. Well, it is. Yes, medical. University, your number one.
Yes, we are.
With this senior. If a redeemer. Ordered. Per day and administer the bed and administer as serum.
We are taking admin.
A patient with chronic has administer oxygen. What is the most rate? See oxygen saturation. Addison's disease. The NASH diet. D.
Yeah.
Do not stop taking. Fourth question. Patient is scheduled prepared according to provide instruction fasting. Kids 2 hours 3 to 4 hours.
Be 6 to 8.
6 to. Question 5 is a to the chest of an pneumonia, a low respiratory. C. A sucking wound. Answer. Flash the.
Before they, I think this was 1 to left. Oh, thank you. At the end of the day, from very much.
Tema University. Petro Medical with blood glucose per deciliter. Breathing. Hyper. D.
Osmolar.
Question. A patient a long flight, most likely edema, pulmonary.
They're taking.
Answer. Question. 60-year-old being in 5 minutes. Most cost. B. Variant engine. Tension. So breath on lateral X-ray show of heart
They are storing output heart failure.
Let's say
Who has which of the likely periods with sexual activity?
tell me since you're diagnosed.
Answer is B. You had problem. Stuart, you need
Let's move.
a
Patient with chronic kidney disease has a hemoglobin
of
of
8,
8.5 grams per deciliter.
which
Which medication is most likely to be prescribed? A. Vitamin B12 and sucrose. B. Iron sulfate and sucrose. C. Folic acid and sucrose. D. Erythropoietin and sucrose.
Our answer is B, iron sulfate and sucrose.
answer?
Acid, erythropoietin and sucrose. Question 2 for them. A patient with systemic lupus erythematosus
Who
has a facial rash and alopecia. Tell the nurse, I hate the way I look. I never go to any place except here to the health clinic. An appropriate nursing diagnosis for the patient is A. Disturbed body image related to visible physical changes. B. Social isolation related to perceived changes
in appearance?
C. Ineffective coping related to chronic illness. D. Impaired social interaction related to altered self-esteem. with full the tab
and I
for the nurse has to not increased amount as a ma need second halation
leave
the next
We all feel there is fairness. Otherwise, people need it. But these are the things we've been studying. Just want you to take it. If you get one or two wrong, you know your chance to shine will come. There's the other question, the other one, which you're very sure. And it is going to happen. And trust you're going to be presented very well. So we're encouraging networking. Let me ask a few people which networks have you made. Have you made a network? Yes. To avoid gender, what is the standard word? You can refer to that network as it. It is seated on tech. Which university? I'm not sure of the name of the university. That one is not serious. Have you made a network? Have you made a network? This one is scared.
A. Bananas.
Let's have the answer. Next question. Thank you. A patient diagnosed with diabetes mellitus is being discharged home, and you're teaching them about preventing DKA. What statement by the patient demonstrates they understood your teaching about this condition? A. I should not be alarmed if ketones are present in my urine because this is expected during illness. B. It is normal for my blood sugar to be between 250 to 350 milligram per deciliter while I'm sick. C. I'll hold off taking my insulin while I'm sick. D. It is important I check my blood sugar every 3 to 4 hours when I'm sick and consume fluids.
D. It is important I check my blood glucose every 3 to 4 hours.
That's the answer, D. Next question. A 30-year-old patient with small bowel obstruction is treated conservatively with a nasogastric tube. What is the primary purpose of this intervention? A. To prevent bacterial infection and decompression. B. To relieve pressure and reduce vomiting. C. To provide nutritional support. D. To increase bowel motility.
A. To prevent bacterial infection and decompression.
Let's have the answer. The answer is B. To relieve pressure and reduce vomiting. Next question. The nurse is performing an assessment on a client with head injury and notice the client is assuming this posture. The nurse contacts the healthcare provider and reports that the client is exhibiting which posture? Refer to the figure below. A. Ophthotonous. B. Flaccid quadriplegia. C. Decerebrate rigidity. D. Decorticate rigidity.
D. Decorticate rigidity.
Let's have the answer. Yeah. The answer is C. They said the answer is D. Decorticate. Let's get the answer and see. Yeah, it was only the change of the writer. Do you understand what you're saying? Listen, look at the answer. Look at what they said on the answer. Am I clear? They said D for them, right? And we have it down there as D, but the word is only that is what? Get down. Sorry?
Let's try to maintain some silence, please.
Good afternoon once again. When the judges are talking, you keep quiet and wait for the judgment. So, I think we all heard clearly the question as displayed. They chose their correct answer as option D, decorticate rigidity. From what we see there, is that decorticate rigidity? It is decerebrate. So the answer at the end was also showing the decerebrate rigidity. So there's just a misconception on the letter. But what we can clearly see is that they gave the wrong answer. Thank you. So they don't get the point.
Let's try to maintain some silence as we invite the next group. As the excitement wears off, the sixth group is coming forward to answer their questions.
This is Soroti University. Let's have your question flashed. Question 1 for you. A client with trauma to the chest develops tension pneumothorax. After a needle thoracotomy is performed, the nurse would expect A, an increase in blood pressure, B, a decrease in blood pressure, C, an increase in jugular venous distension, D, a decrease in level of consciousness.
Our answer is A, increase in blood pressure.
Let's have the answer. The answer is B. Next question. The nurse is caring for the client with increased intracranial pressure. The nurse would note which of the following trends in vital signs if the ICP is raising. A, increasing pulse, increasing respiration, and decreasing blood pressure. B, decreasing pulse, decreasing respiration, and increasing blood pressure. C, decreasing pulse, increasing respiration, and decreasing blood pressure. D, increasing pulse, decreasing respiration, and increasing blood pressure.
Our answer is B, decreasing pulse, decreasing respiration, increasing blood pressure.
Let's have the answer. Answer is D. That is increasing pulse, decreasing respiration, and increasing blood pressure. Next. Sorry? Yes. Next question. A patient with history of alcohol abuse with confusion, ataxia, and that word there. Which vitamin deficiency is most likely? A, vitamin B1, vitamin B3, vitamin B6, and vitamin B12.
Our answer is A, vitamin B1.
Is that the answer? The answer is right. Next question for them. A client with osteoporosis is assessed for nutritional status. The nurse identifies a diagnosis of imbalanced nutrition, less than body requirements. Which client statement supports this diagnosis? A, I like to remove all of the fat from the meat I eat. B, I'm trying to eat a low-carb diet. C, I plan to start eating out less. D, I'm allergic to dairy products.
Our answer is D, I'm allergic to dairy products.
Let's have the answer. The answer is D, I'm allergic to dairy products. Next question. A patient with chronic liver disease has an elevated ammonia level. Which dietary modification should the nurse implement? A high protein diet. B, a low protein diet. C, a high sodium diet. D, a low carbohydrate diet.
Our answer is B, low protein diet.
Let's have the answer. The answer is B, low protein diet. Have you answered all your 5 questions? Let's have set 7, university number 7. That is must. Must. Are we ready to go?
Yes.
Question 1. During an assessment of the patient's motor status with the Glasgow Coma scale, the patient assumes a posture of abnormal flexion. The nurse would document this finding as A, 5, B, 4, C, 3, D, 2.
Our answer is C.
Let's have the answer. Answer is 3, you're right. Next question. A patient with spinal cord injury at T6 develops severe headache, flashing, and bradycardia. Which condition is this? A, spinal shock. B, autonomic dysreflexia. C, neurogenic shock. D, orthostatic hypotension.
Our answer is semi-organic shop.
Let's have the answer. The answer is B. Question next for them. The emergency department nurse has just admitted a patient with a burn. The nurse recognized that the patient is likely to experience a local and systemic response to the burn when the burn exceeds a total body surface area of A, 10%, B, 15%, C, 20%, D, 25%.
Our answer is D, 25%.
Let's have the answer. The answer is C, 20%. So your answer is wrong. Next question. A patient with a fractured hip is placed in the back traction. What is the purpose of this type of traction? A, to realign the fracture. B, to immobilize the joint. C, to reduce muscle spasms. D, to provide continuous skeletal traction.
Our answer is D, to provide continuous skeletal traction.
The answer is C, reduce muscle spasm. So you're wrong. Last question. The client with acute renal failure is recovering and asks the nurse, will my kidneys ever function normal again? The nurse's response is based on the knowledge that the client's renal status will most likely A, continue to improve over a period of weeks. B, result in the need of permanent hemodialysis. C, improve only if the client receives a renal transplant. D, result in end-stage renal failure.
Our answer is A, continue to improve over a period of weeks.
Let's have the answer. The answer is A. You're correct. Thank you. Let's have the This is Kabale. This is Kabale. Let's have question 1 for Kabale. Question 1.
Goes. Order, please. A patient with heart failure is on fluid restriction of 1.5 liter per day. Which of the following should the nurse include in the teaching? A. Ice chips count as fluid intake. Only water counts as fluid. C. Fluids can be unlimited if the patient is thirsty. D. Intravenous fluids do not count.
A. Ice chips count as fluid.
Let's have the answer. The answer is A. Ice chips count as fluid intake. Question 2 for them. A patient with cerebrovascular accident, bracket stroke, has right-sided weakness and aphasia. Which area of the brain is most likely affected? A. Left hemisphere. B. Right hemisphere. C. The brainstem. D. The cerebellum.
A. Left hemisphere.
Let's have the answer. The answer is A. Next question. A patient with cirrhosis is disoriented and exhibits flopping tremors during assessment. Which laboratory result best explain these findings? A. Decreased magnesium level. B. Increased calcium level. C. Increased ammonium level. D. Increased creatinine level.
C. Increased ammonia level.
Correct. Question 39. A patient with tracheostomy tube requires suctioning. Which of the following is correct? Apply suctioning during insertion of the catheter. B. Suction for 30 seconds to ensure thorough clearance. C. Use sterile catheter for each suction pass. D. Hyperoxygenate before and after suctioning.
C. Use a new sterile catheter for each suctioning pass.
Let's have the answer. The answer is hyperoxygenate before and after suctioning. Let's have question last. Let's have your last question. A patient with chronic heart failure is prescribed spironolactone. During follow-up, he complains of muscle weakness, and the ECG shows peak T waves. What is the most likely electrolyte imbalance? A. Hyponatremia. B. Hypokalemia. C. Hyperkalemia. D. Hypocalcemia.
C. Hyperkalemi.
Thank you. So we come to the end of medical surgical. Thank you. MC, get your mic.
We have received a number of queries, so we are going to request, before we start the next round, we shall just have a short break, we review, then we shall give you what we have found out and decided on, and we continue. Are we together? So the DJ or the MC can entertain us.
Thank you so much. We have heard from our judges after this medical surgical nursing session. Lira is still good. But in the other version of Gumite, for them they are Gumaite. But it is fine. But after this session, for real, our initial questions were for medical surgical nursing. I'm sure right now, you might be in a situation, and for me I've seen that a situation is not permanent. You might be doing bad right now, but after answering, and then you're even worse. That's why I'm thinking we need a Bible verse, at least one Bible verse. Any Christian should give us one Bible verse, and yes, I have seen one hand here.
Okay, let me be nice. Jeremiah 1:7. Okay. It talks about how Jeremiah didn't believe in himself, and he called himself young. And then God told him that I will fill you with the words that you will go out to tell the world. So those who were weeping, be strong. You're the chosen ones.
Yeah, I think we need to give him a round of applause, colleagues. And do you want to dedicate this verse to any university? Where has that universe just show? Okay. Any other question to give us one Bible verse? The dedication, I think we leave the dedication part. Maybe they judge for themselves. Yes. Uganda Christian University, there is a hand here.
I think girls will love Jeremiah. Mine is 29:11. For I know the plans I have for you, plans for prosperity and non-disaster, and plans to bring about a future that you do hope for. I dedicate it to Uganda Christian University because the Lord can't bring us this far to fail us.
Wow. This is, it needs a thunderous one. A thunderous hand clap. There will be signs, It's also consolation, Thank you so much, Uganda Christian University. Let me see if there is an opportunity of another hand. This is Kabale. They have Bernardo Silva. Here. So let us hear this one.
Proverbs 1:7. The fear of the Lord is the beginning of wisdom, but fools despise it and refuse to learn. Yeah.
What is the motto of your institution?
Knowledge is the future, but we fear the Lord.
Oh, there will be signs. You can say, at times they are quotes here. But we shall see. We are still having other questions, I'm telling you. As if the judges are prepared. Okay, there is another hand this side. As we wait for the judges, they also see that the situation has not been easy. Yeah,
This one is a Muslim actually.
Good morning, everyone. Hey, good afternoon. My name is Tarema Issa. I'm a Muslim, but I know the Bible part. So in John 11:35, it says that Jesus wept. I wish I can dedicate the university, but it not itself.
Let me just judge and see if they know themselves. Let me ask Busitema. These people have a lot of impartiality. Where do you think that man has said? Where does he come from? Which institution? I don't know. Let me see from Kagari. He's a student here. Let me see from. Oh, okay. Let us leave that part. We shall continue from there. Thank you so much.
Okay. Thank you so much, MC, for that. As I mentioned, that we received complaints, and number one was with Muni University on the question of decorticate and decerebrate rigidity, right? From the picture that was displayed, Muni University actually got the correct answer. So as the judges, we are awarding them that point. Thank you. Then also, the other university that raised a complaint was Soroti University, still in medical nursing. The answer that was displayed was wrong, and the answer that they gave was correct. And therefore, we are also awarding Soroti University 1 point. So we can display the question. That was, I think, question 26, so that everybody just has clarity. It was about Cushing's triad. The question was about Cushing's triad. I think it should be question 26 or 27. What we pass is judgment, not debate. So I think this is question 27, that the nurse is caring for the client with increased intracranial pressure. The nurse would note which of the following trends in vital signs if the ICP is rising. And I think we know that what we're looking for is Cushing's triad, right? So option A was increasing pulse, increasing respirations, and decreasing blood. And then we have decreasing pulse, decreasing respirations, and increasing blood pressure. And then C, we had decreasing pulse, increasing respirations, and decreasing blood pressure. And then D was increasing pulse, decreasing respirations, and increasing blood pressure. What was the correct answer here? The answer here was D, right? And so what university's answer was B. Yes, we are going to review. So what do we know about Cushing's triad? There are 3 parameters, right? We are not in a shouting match. So you keep calm, we review the science, and then we give you the correct answer. Are we together? Okay, so if you start shouting from the judge's desk, you can easily be disqualified, and the quiz will continue. So, Cushing's triad, what do we know? There are 3 factors. We look at the pressure, the heart rate, and the breathing, right? What happens to the pressure? So we have hypertension or increasing pressure. Do you have it here? Okay. Then the next item, which is the heart rate. What happens to the heart rate? It reduces, so we have a bradycardia. In this option, what are we saying? Increasing pulse. So that option becomes what? Wrong. Are we together? So the answer given there is wrong. So Roti University's answer was B. Let us go to option B. Go back. C. The answer, according to the person who was doing the reading here, he actually agrees that Soroti gave the right answer. And the answer that they gave, as written here, is decreasing pulse, reduced respirations, and increased blood pressure, which is actually what we have in Cushing's triad. Are we together? So it's upon that review that we came up and said that they were correct, and we have awarded them the point. Do we all agree? Thank you so much for your attention. In case of any other complaints, then they also, Soroti University also raised complaints on questions 5 and 6. Question 26.
To reduce the pressure, the blood pressure does what? Normalizes. So the answer was a decrease in blood pressure, because the initial one was a compensation because of the decrease in venous return. That was the only science there.
Thank you for your concerns. The judgment has been passed and the answer is correct. We are no longer entertaining discussions. You can appeal to the High Court. Thank you. So let us proceed. Next round.
Welcome back from that round. It has been exciting for some and depressing for some. We appreciate your Bible verses and any words of encouragement. So, before we get into that session, this is specific to Lira University. I love poetry, and so you will have something from me. Grave men near death, who see with blinding sight, blind eyes could blaze like meteors and be gay. Rage, rage against the dying of the light. It's a poem meant for all people who are losing their ability to live and their ambitions due to certain failures they've had in their life. But this is an advice to you to rage against the dying of the light. If we want the truth, we shall get it by all means. I believe in you, and therefore, I would like to invite 8 representatives from each group to each pick a paper so that you can get the order in which we are going to do the next postulate, which is midwifery.
Number 4. Must number 2. The system number 5.
Lira University number 1.
University number 7.
University
3.
Sorority University number 6.
So I would like to invite the first university to come and take the floor.
Wide angle, my bed wide, like the widest.
There's another question about this question here. Look at the question, the way it says. It's trying to ask about persons which are coming as a result of the surgery, not before the what? The surgery. And that's the which answer was wrong? And which answer did they give?
Busitema University gave the answer as C. The question was questioning on whether, because it's saying post-surgery, so our focus was after the surgery. Your answer C was assessing before and after the surgery. So that the most correct answer according to the question, not what you think, according to the question. That is the most correct.
And to put things into context, when you see this one here, not everything applies. Because I've been highlighted it in capital letters that I need. They may be correct, all of these things, but the word is most in capital letters.
So on that basis, I think we have addressed that concern. What have you understood?
Someone wants to assess the patient as a result of the cancer, but the question was the result of the surgery, not the cancer.
Okay, you could display the question. These are just for academic issues, nothing much. When conducting an interview with a client who has had surgery for prostate cancer, which of the following statements by the nurse would most likely elicit information about the client's sexual concerns? And to us, you are saying B is the most correct. Following your prostate surgery, when did you first notice you had problems with sexual intercourse? That is very, very subjective. To us, we are very sure this patient having, the client's sexual concerns are not limited, especially when someone has been diagnosed with cancer, are not limited to the process after surgery. Actually, surgery may not be the problem, but the problem is from diagnosis of the cancer. So for us, telling me about your experience with sexual function since you are diagnosed with cancer, that includes before and after operation, gives me a better view of the sexual concerns of this patient.
Okay, thank you for, I think, is that all from your team? Yes, because you, okay, give another hand. Say, after you've given your opinion, we shall pass judgment so that we don't argue.
Thank you.
Yes.
In summary, we are trying to assess what exactly happened to the patient after surgery, right? So what if this patient actually came in with a sexual dysfunction before surgery? How shall we know?
Okay, thank you. I think I like the session because you are quite inquisitive, which is nice. Emotions are boiling and we're interested in getting the point to our side. Now, first of all, I don't know how many of you are in 40. There's another hand. Yes. but we cannot finish. Last hand.
Yes, I stand here to object the proposal from our friends, Bustema. Yes, I think they're relying on the point when you have to get information from clients, you're supposed to ask open-ended questions, which I agree. But at the same time, we are also here in medical field. So if a patient is having a problem with renal failure, you don't give treatments of lung dysfunction. So that is what Booster University wants to prove, that if a patient has a problem with renal failure, we treat with respiratory dysfunction. So in medical, we treat the reality.
Yes.
That's my point of view. Thank you,
my brother. Thank you. We have received all your complaints. You see, let us listen. No, we have received the 3 complaints. We are no longer receiving. Yes, sir. Judgment is coming. We are not receiving complaints. In the court, you debate. After the lawyers have talked, we pass judgment.
Good afternoon. Yes, I know we are in academia where we can judge. But this question requires the responses that are pointed to focused assessment, not a comprehensive health assessment. Because this is a patient who has had surgery, you have been with this patient. So you want to assess whether he's getting complications after surgery, and that's focused health assessment. So let's not go that way. We shall waste much more time. Let's proceed, I think.
So thank you to all our lawyers for debating. The judgment is your answer was wrong. The answer here was correct. Thank you.
Yeah, it's understandable.
It is part of life to be misunderstood. So that's why it's understandable. And it's also part of life to feel like you're aggrieved and you're not getting the response. But remember I talked of soft skills. So some of the soft skills require you to be mature, to realize that when you are having a disagreement, you can agree to be disagreeable, but be respectful. You know that others also have opinions, and your opinion is not always the correct one. Much as you may strongly feel about it, it does not necessarily make it correct. So as you mature into professionals, you're going to realize this. So let's listen from...
Okay, thank you so much.